that a lot of times when people get in recovery, and just because you're working a 12-step program of recovery, it doesn't mean that you're necessarily getting better. I mean, you can get better and you could stay away from the drink or the drug, but sometimes there's some other issues you have to work through, and it sounds like for this guy, maybe some of these other issues are coming out.
I think it's quite possible. I think one of the biggest gripes that I have, I'm trying to move closer. I'll get there.
If you have to lower the seat, you can do that too.
No, it's okay. How's this? Is that better?
That works for you.
Okay. I'm learning the ropes.
Sounds great.
I'm learning the ropes, yeah. But
one more mistake, you're out of here.
But I think one of the challenges, I think, in people going to rehab is that either they're sold a bill of goods or they believe in this idea that somehow after, and I discussed it with someone earlier on the way, in, that, they go through a 30-day program or they go through a 60-day program, and then all of a sudden the world is fine, the world is wonderful, and, it's just uphill from there on in. The reality that I see with people in my office is they've kind of engaged in years of stuffing all that, what I call that crap, that garbage inside. And they've used it through their addiction, to deal with it. And now the garbage, you have to take out the garbage.
Right.
I take out the garbage twice a week. I have to. That's my job, by the way.
Sure.
And
Got your honey-do list?
a honey-do list? Yeah, I have.
Honey-do list.
I have to keep it private, though.
Yeah.
So we take out the garbage, right?
What's that called? Divulge? Like when a therapist can't say too much about their private life. What is that called? Like a therapist should never say too much about their private life to
I don't know what the term is, but it might be crossing boundaries.
Yeah, but we'll
but
go with that.
I do share with my clients. I think when it's helpful to them, I do share parts of my personal life.
Sure.
That, as examples to help them, to show that I'm a real person. I have real problems, real concerns, real challenges. And I think when people go into rehab, they think, well, I'm going to be fixed. I'm here with people, and I'm going to be fixed. I'm going to get out, and now I'm going to feel wonderful. And I can't say the word, but I'm going to say crap. Okay, you know what the
Crap's
word is.
okay, yep.
Right. And I say, why? Now I'm out of rehab, and now why do I feel like crap? Like I actually feel worse than when I first came in. I have a lot of knowledge, a lot of information. Hopefully, you'll have a program in place. You'll go to 12-step meetings. You'll have a sponsor. You'll start doing what you need to do. But you're feeling like crap. So my answer to them is, yeah, this is real life. You're going to feel like crap because you've stuffed all that crap in your garbage pail. Now you're throwing out the garbage. Now you have to decide. Are you going to fill it up with the same old crap? Or are you going to replace it with, I don't know, I don't want to say new garbage, but replace it with new things in your life. So new, challenges come up.
Inviting chaos is what you're talking about. Invite new chaos, creating new problems, and building new resentments.
Well, it could be. It could be because really, you've pushed it down. And one of my, I have a newsletter through my website and on Facebook. And one of the topics that I recently addressed was when one person changes in a relationship, like what happens to the other person? And so let's assume like a person is in recovery and the other person is not in recovery.
Right.
Now that other person is either protector or you're a defender or they're codependent on you. They have their own needs that they're fulfilling, and they see you maybe as a very weak, vulnerable person, and they might be supportive and say, yeah, I want you to grow. I want you to get better. I'm here to support you. And it might be the truth, or it just might be their way of filling their own void.
Right.
And then when the person starts getting better, they start to feel resentful. They start to feel like, well, I don't like what I see.
Because they don't need you anymore.
They don't need you anymore. Yeah,
Wow.
that's a good point.
I went through that myself.
Yeah.
Actually. Long time ago.
Yeah.
Yeah, my son's dad. I tried to get sober back then, and I was just not drinking, but I started doing things. I went to school. I did, I got 2 jobs. That. And he couldn't stand me. He left me.
Because you were doing too much on your own?
I guess I just started to be a real woman.
So I've never been
one to, like, oh, please, but yeah, but he saw me get stronger.
Wow. So
Yeah.
I guess that's a pretty common thing then.
Yeah.
And it happens with a lot of relationships. When one gets sober and the other one all of a sudden doesn't have to take care any longer of that person who's now in recovery, I'm sure there's a bit of an adjustment period.
There is a bit of an adjustment period. It's important for the partners to speak to each other about the changes that are taking place. And what happens is one person is kind of moving up, growing, and the other person is kind of standing still. So they really need to have a dialogue. Hey, these are the changes that have taken place in me. Because I always tell my clients, nobody has the crystal ball. And, you might think, you do? Well, I'd like to play the lottery this weekend. Can you tell me what the numbers are? Because I'd like to play.
Just don't say it on the radio because we don't want to split it this many ways.
Right. That's true.
Yeah.
That's true. Tell me afterwards. Yeah.
Okay, so no, and I do think it's important. I'm always a big supporter of people getting therapy, and I'm one of those people who believe that why not increase your odds of remaining sober? And to me, just going to 12-step program is great, and it worked for me after 90 days of treatment. But for me, I had to also go see a therapist and do an IOP group and to be really involved with other things that were increasing my chances of remaining sober and dealing with my issues at all angles. So, and I think it sounds like that's what you're doing. So what type of people do you see? Are you seeing people who are coming in right off the street of they're still using and then they're coming in as they finish to come in with you? Or are you seeing people who are coming in from treatment afterwards?
Seeing all kinds of people. I'm seeing people that just got out of rehab recently. I see people that really haven't been working a program at all, and they need to work something. They think I'm finished. I'm all there, and there's nothing more that I need to do.
What's the frequency of how often do you see someone?
What do you mean?
Like how often? Like if I came to you right now and said, "Hey, man, I'm smoking crack and I'm messed up," how many days a week would you see me?
Well,
is it like an inpatient or a IOP or?
Well, that's a good question. No, I do outpatient work. So I am like on the tail end of what a lot of the rehabs would do. They would kind of phase somebody down, or what they call it is stepping down. And they kind of are very territorial with that. They like to get you into the PHP, move you to IOP, move you to outpatient. And I think sometimes it's good to get out of that realm, that kind of bubble, and kind of get a new perspective.
Absolutely.
Because this is my belief. I'm not in recovery, but this is my belief. I believe that people in recovery should be in a 12-step program or be in some kind of program.
Yeah.
For some people, it's alternative programs too, and so some
type of support group.
Right, some type of support. They should have some kind of mentor, and a family member is usually not the one to do it.
They're too close.
Yeah, and they don't get it. They don't get it. They don't really understand what the person. They can pat you in the back and tell you, "Don't worry, everything's going to be okay. You got your whole life ahead of you," and this and that. And they mean well, but their advice is not really, palatable
No.
as far as I'm
Bad
concerned.
advice.
Right.
Bad advice.
It's
Somebody
bad advice.
that hasn't studied it or hasn't been through it themselves.
Correct.
Bad advice.
Correct.
Yeah.
So I will tell my clients, by all means, let them know that I'm not in recovery, because sometimes they say, "You're not in recovery, like, how are you going to treat me?" And say, "Well, listen, you're going to go to your 12 steps or whatever you do. We're going to set up a program for you. We're going to talk about your addiction. What we're going to do is we're going to kind of peel the layers of the onion. That's what I call it. Okay?
Mm-hmm.
And we're going to look
off with I have a disease. So basically, that's what as soon as they find out that addiction's a disease, that's what they say. And then, what was the point that you were making with that about the disease?
It is a disease because what happens is when a person becomes addicted, they're physiologically and psychologically addicted. And when they talk about a craving, there's a physiological component that's taking place. So what's happening basically is that your brain has chemicals in it. Basically neurochemicals, and it's transmitting from neuron to neuron. I don't want to get too technical about this.
Sure.
But we have our natural, opiates, our serotonin, dopamine. You've heard of all that. There's 5 major ones that really help us function. Those are the natural chemicals. Some people call it jogger's high, or if you go to Disney World, or you're having sex and you feel good, and it works on the reward centers of the brain.
Mm-hmm.
Here's the thing: drugs work on those same areas of the brain.
Right.
The only problem is that drugs, substances, replace those natural chemicals. Right?
Right.
They block them. And what happens then is, at that point, your brain is saying, feed me. Like, remember Little Shop of Horrors?
Yeah.
And he used to say,
Feed me.
Right. And you have to feed the demon. And so,
Feed me, Seymour.
Right, exactly.
Hit
You know, so
impersonation.
you have to feed that addiction. So it's not a matter of willpower. People keep saying, people that don't understand, or family members, or people that are not in addiction, they say, well, you just have to like pull your bootstraps up and do what you need to do, and just exercise some willpower, and everything will be okay. And it's more than, if it was just willpower, then, now some people can do it on willpower. I give them the credit.
Yeah.
But most people cannot do it, because what's happened is the brain now has been physiologically affected by
Altered,
these
yeah.
chemicals. It's been altered, correct, that's right. So the natural chemicals are blocked. They're overtaken by drugs, legal drugs, illegal. Now, when I say drugs, you have to understand one thing where I'm at. Okay, and I tell my clients this. I talk about not just street drugs. I'm talking about over-the-counter remedies. There's a lot of people that are abusing Tylenol PM.
Oh, yeah. What about alcohol, too? I mean,
Alcohol.
talk about drugs, alcohol.
Right. Absolutely. I mean, alcohol is socially acceptable, and that's the excuse. Well, you know what? It's social. I'm not shooting up, right? I'm not a bottom feeder. I'm not an alcoholic. I just have a few drinks to unwind. That's how it starts.
And this is definitely a conversation that we could continue on forever.
Absolutely.
I was going to say also that weed is becoming socially acceptable now also, which is creating a whole new slew of problems. But I do want to say, because we have someone on the phone, and he's not going to be on the phone with us for too long, so I want to at least get to him and ask him some questions. I know James has a bunch of questions for him. So, David, you there? Never mind.
I saw him trying to Skype David in a minute ago.
Oh, okay. Yeah, no worries. He's going to call in. Okay. Yeah, no problem. All right, so then we could definitely keep going then. Now we got some more time with you, Irving.
I have a question for Irving.
Mm-hmm.
So you're not in recovery, right?
I'm not in recovery, no.
What caused you to want to do this for a living?
That's a good question.
Why treat people like us?
Yeah, because I mean, look,
People
I put
like
up with
us.
a lot of garbage. And the next question I was going to ask you is why you think the recovery community implodes upon itself and everybody attacks each other. But why did you want to deal with that madness?
Well, I've worked in a number of treatment centers, and they're gonna remain anonymous. One of my concerns is that they all talk about individualized treatment, and the more I worked in them, the more I found out that they were all the same. They all practice the same formula. I tend to, in my practice, have a different approach. Now, people will disagree with me, but I'm going to stand my ground. It's my practice. I have a good success rate with people that are in recovery, and even in people that in active addiction. But I want to preface it by saying, like, if someone is really, really using a lot of hard drugs, consistently, they might need to be in an inpatient program. I have no doubt about it. I prefer people to programs. Mm-hmm. But I'm talking about the people that maybe occasionally are justifying, like maybe, Blake, you mentioned, pot use,
Yeah.
That's one thing, especially now with medical marijuana. So we have this idea that, okay, it's becoming more acceptable, like alcohol. It's very innocuous. It's not. Research has shown that it really kills brain cells.
Oh, yeah.
It also doesn't help your sex life. You think it does, but it doesn't. If you want to have a good sex life, it really doesn't. You might psychologically, it might lower your impulse control, but, in terms of sperm count, it really doesn't help you.
Yeah, right.
So there's something for young guys to consider. I think there's no consensus right now on really what is the one formula for recovery. And I think what works for one person doesn't work for all. And I think this notion of like one size shoe fitting all. When I work with my clients, and I have clients that work that have addiction, they're also in recovery. I find that a lot of them have anxiety and depression, and I have my arsenal of skills that I use, modalities that I use, treatment approaches. But I find that maybe one approach will work for one person, and another approach will work for another person. So I'm not as dogmatic. And what I've noticed that happens in the rehab community, maybe especially down here in Delray area, is that they tend to kind of like speak the language of individuality, like we do things different. And I've worked in a number of them to know that when it comes down to it, they all do the same stuff. And I think a lot of them have the best of intentions starting off, especially when they're small. When they're small, the group is very tight-knit. The therapists, the clinicians, the administrators, everyone is kind of like working as a unit. And then what happens is this thing called money and profit takes over, and they get larger, and the insurance starts pouring in, and now they start increasing the staff load, and they can't keep up with it. And as a former therapist in the addiction world, I can tell you, like, the caseloads are phenomenal, and to be able to give the clients the kind of care that they really need, individualized care, it ain't going to happen. It ain't going to happen. It's just the formula, and it's like one size fits all. And I just feel that rehab is just the start. We need to look at what's working and what's not working. And I think part of, the problem is that there are people that don't necessarily, they've gone through recovery and they're running a program based on their vision of what worked for them, rather than an understanding of really what it takes to run a program, and what works for one person will not necessarily work for another person. So it really needs to be individualized. And unfortunately, I think the profit motive gets so strong here that people lose their idealism.
I was lucky when I went to Inspire, and I was the third client there. And we had that one therapist all day long, and that lady broke me down. Like, there was three clients. She was with us all day long, and we got nothing, almost all individual, hour sessions, and that worked for me. I don't now, all the people that are in like a big, a bunch of people going, I'm not really sure I could have, I don't like being around all those people anyway. I just can't pay attention.
Really?
Yeah, they get in my way. But it was real, and I was able to open up finally, and I've shared on here before. She was hardcore, man, and she got stuff out of me that I didn't realize. Well, I knew they were there because I would think about them, but I didn't know how bad they were affecting me. And I mean, I am so grateful for where I went through. And they're a great.
And
That's another show.
And you were at the stage when the program was just starting, and it was smaller and more individualized. And what I find is having facilitated groups myself in addiction and out of addiction is up to 10 people is a group. Anything more than that is just a mob.
Yeah.
I mean, that's not therapeutic. It really is not. And what happens is the profit motive is driving these facilities up to having. I've facilitated. I've tried to facilitate groups that have 30, 40, 50 people in them.
No.
I mean, how can you, aside from maybe doing an educational component, what else can you do? How can you really get into the issues? And another beef that I have is, like, we're talking about some hardcore issues that I think need to be addressed on an individual basis. Mm-hmm. Let's take the fact that there's a high percentage of people, and it tends to be more women, but we're hearing about it in terms of the male gender as well, that have issues with physical abuse, sexual abuse, coming out of those relationships, all of the above. And now they are told by the director or their therapist, you need to be in a special group meeting with other women to talk about your trauma.
No.
To me, as a therapist that deals with people who have been traumatized sexually, physically, emotionally, verbally abused, may be doing drugs or may not be doing drugs, have depression, have anxiety. To me, I find that the individual approach, one-on-one, works best. Throwing it out there, of course. Yeah.
Go ahead, David.
Some I want to kind of add on to that, Irving, and to circle back where we left off before the break. You know, one of the issues with treatment programs is that we're dealing with an exceptionally vulnerable population that is really damaged. The chemical dependency part is just part of the story when we start talking about complex trauma and abuse and PTSD and the host and mental issues that come into play. That's a very, very tough case to deal with. Yet, there's going to be some people that are not going to be real happy with what I'm about to say. But if you look at the regulations, I was just in the regulations in the state of Florida, what it takes to open up a treatment program. Just about anybody that can fill out an application and cobble together some people and some money can open a treatment program. And so I want to sort of gently disagree with what Blake said a little bit about, you know, you got to be a therapist or a licensed person. I'm not sure that I necessarily agree with that, but I do think that there needs to be some foundational benchmarks that we need to hit as professionals in the field for creating an environment in which this kind of work is going to take place. And if we don't do that, then a lot of this other stuff is, you know, people fall through the cracks and people don't get the help that they really need.
I agree with you also on that, David. I'm a little on the other side from Blake from that, to whereas if you can't be an owner if you're not a doctor or something. I don't know.
I just think that
I'm a little on the other side.
I just think that if you're going to own, or at least maybe not own, let's say operate a treatment center, be at the helm of a treatment center, that you should have a clinical background so that the decisions being made for the treatment center are not about money, they are about the patient first. That's how a person can get better. But when you're making decisions based on the money that you're going to be receiving or not receiving potentially, then the patient's chances of getting better and their treatment is going to diminish.
Right. Well, and so here's the thing. Last treatment center I ran, my partner was a marriage and family therapist. I'm a drug and alcohol counselor, and we made a decision together that we were going to make clinical decisions ahead of business decisions or financial decisions, more to the point. And I'm really, really proud that we were able to do that. But let me tell you something. That gets really tough when the right clinical decision has a bunch of negative dollars attached to it. And in the for-profit world, people get caught up in that. That it's not only profit motive that comes into play, it's that people get in over their head beyond their ability to run a program, and now they're starting to feel the pinch of, man, if I let this guy go, I'm not going to be able to make payroll. And I hired two of my buddies and one of their girlfriends to come in and do tech work for me. So it's a complex process.
I definitely agree with that. I guess, I mean, the person who would be running it, and I'm thinking of a couple centers around here that are great, that are owned by clinicians, but that are clinicians that are also business savvy and know when they have to make the tough decision, but know how to do it properly. What I'm talking about when it's improper is when all of a sudden someone's insurance drops them down and get out of they're 10 days in to a 30-day program, and all of a sudden drops them down after 10 days, get out of my program. See,
I don't agree with that either. That's why I'm very happy where I work at the treatment facility I work at. If the doctor says you need to stay in there for 60 days and your insurance drops after 10, you just get 60 because you walk through the door. We said we were going to help you, and that's the end of it. You just get whatever the doctor ordered.
That's what it was
and it happens that way sometimes, but that's what it is. You have to eat it and go on.
Sorry, go ahead.
I was going to say that I've worked in a number of programs. There's not too many of them, but they scholarship people as well.
Yeah.
Of course.
So there is a balance with some programs that they do exercise some compassion.
Look, I'm not saying open up a beautiful treatment center and then just bring everybody in for free, and just because it's based on clinical decision, you want to help them. What I'm saying is that I think the clinical needs to be looked at first. Of course, the money still needs to be looked at. The business side still needs to be looked at and evaluated and then incorporated with the clinical side. but it can't just be, decisions cannot just be made on a business basis.
Right.
I agree with you 100%. And so if you know, when you set up a program, if you come up with some sort of fundamental policies, for example, our agreement was that if we took you into our facility, you were going to get 30 days. It didn't matter what insurance was going to do or
Right.
whether or not they paid a dime. You were going to get 30 days, and at the end of that 30 days, we were either going to keep you if appropriate, or we were going to facilitate a strong referral. And then what that did is that took any question out of the front end. If insurance went sideways, well, man, then we're going to figure out how to make it up down the line. But this person, this human being, this suffering, vulnerable human being, is going to get really, really good care for the next 30 days.
And that's great, and that's exactly what people should be doing, and that's what unfortunately doesn't happen around here enough. And you guys did that because you guys were both trained in ethics. You know, you both have clinical backgrounds, so you're trained in ethics, so you put a rule in place, and that's what I mean. I don't think there's people are throwing the idea of a weekend course for business owners who want to own a treatment center. There's a weekend course you could take on ethics, and then you're qualified to own a treatment center, and that's BS to me. I mean, you need to be trained, and clinicians go through rigorous courses on ethics, and not just one course on ethics.
Well, it's like taking a weekend course on Botox, and then you go
Right.
and you open up your own clinic. And, you know, I mean, I wouldn't go to that person. I want a little more expertise.
Can I say hi to
Go ahead, Lisa.
I want to say hi to Casey and Donna. Sorry.
Hi, Casey and Donna.
Hi,
Who's
Casey and Donna. Casey's my friend that's watching, and Donna happens to be a girl that I went to junior high school with. And I guess they're watching because it says they are. So,
Okay.
hi, you guys.
Good.
Very
Yay.
cool.
Welcome, Casey and Donna. Welcome to
Welcome.
Recovery Radio FM. So I want to ask Irving something, and not that I'm disagreeing with him, and I want to hear what David has to say about it also. Irving said, you know, the larger groups didn't work, and I have to tell you my experience. Now, this is not treatment that I'm talking about, but the recovery center that I went through, there's no clinicians, there's no therapist, we have a doctor that's heavily involved that comes by and would teach recovery classes out of recovery literature, out of the big book, whatever. But we did rooms of sometimes 300 people, and we did 5 classes a day, all of it 12-step related. Every bit of it was all 12-step, and I stayed there for a little over a year. It's usually 6 to 9 months, and the success rate on this place is 76% of people that complete the program, that complete it, not that walk in the door.
Yeah.
76% of people that complete it make it to a year. So we found a lot of success, and I'm talking about rooms with like a normal sized room will have 100 people in it, but it's, you know, the men and women are separated too, by the way. There's a men's campus, there's a women's campus down the road. It's 100% free. So I'm trying to understand what you mean about like the larger groups don't work, because that's the only way I know.
I think are you referring more like to an educational type group? Like more of a lecture format.
So it's a homeless shelter.
Yeah.
It's a 6 to 9 month program. You
Yeah.
show up. There's a non-medical detox. We go into there, and then we go through. Let's say the program takes you 9 months. Let's say it takes you 6 to 9 months. So anywhere in any of that given time, you can break a rule, and they'll make you start the entire program over again because your behavior hasn't changed. Or you might get set back 2 weeks or 3 weeks and go redo something because your behavior hasn't changed, and you suffer direct consequences for your behavior. And you get pulled out of the group of guys you're going through with, and you might go back to the beginning of the program and start again. Behavioral modification over a period of time. So, and you live there. So I don't want to call it inpatient because it's not treatment, but it is a homeless shelter that I went to. And there's 300, or actually there's 600 men, women, and children every day.
It may be an excellent program, and I'm certainly not going to knock it. I don't know much about it, and I don't want to stereotype it. It's just been my experience. I mean, I'm thinking more in terms of like process type groups where people have a chance to really talk about the issues that are behind the addiction, not so much of an educational component. When you get into the larger groups, it gets very, very diffuse. And there's a lot of distractions, a lot of interruptions. There's a lot of different agendas involved. People are talking to their friends. So it's hard to really
People are on their cell phones.
Yeah, exactly. They're looking at.
Oh,
you know,
well,
they're looking,
I see what you're saying now. So
Yeah.
in our large groups, you're not allowed to have cell phones whenever you go through here. And there are a lot of people in there. There's a lot of distractions. There's a lot of stuff going on. And we have the saying, it's fellowship with many, recover with few. So you listen to all these other people. You're engaged with them in this class. But then, of course, it's 12-step recovery. So you do that one-on-one work you're talking about with your sponsor. And that's how we arrive at
right,
that.
right.
David, what about you?
Yeah, I'm with Irving exactly. I think that I facilitated a whole bunch of groups, and at the end of the day, in order, particularly process groups where that heavy work's being done, you got to have an engagement by the entire group. The bigger the group, the more people tend to slip out and be anonymous right there in the room.
That's true.
I agree.
All right, I think that sound means we're going to commercial.
So we are going to go to commercial in about 2 minutes, but I before, because I know it's getting late at this point. So, David, repeat where people can find you one more time.
So email address dskinesny@gmail.com, and look forward to catching up with you guys again.
Awesome. Thank you so much for calling in, David. And then, Irving, where can people find you? If any people down here in Palm Beach County who wanted to get some one-on-one counseling, who are just getting out of treatment, or who may have not gone through treatment and need some counseling, where can they find you?
Okay, well, the easiest way is probably to go through my website, which is www.mytherapistdelraybeach.com. Again, www.mytherapistdelraybeach.com. There's a lot of information there. You can take tests on anxiety, on depression. You can learn about addiction. There's a blog post there. There's a lot of good information. And you can also call me at 561-404-1482.